Hi all, today what I'm going to do is start the theory side of skin camouflage. On YouTube I have added a couple of videos, one of me doing my own makeup. I've got acne rosacea, I've got blemishes, I've got a bit of everything. I've got dark circles around my eyes, and what I've done is a video on all the colour matching, and then I've done a time-lapse video of me doing the makeup over the top of the skin camouflage, so that's definitely worth a look. I've also done a tattoo cover-up little mini video of images as well, so both worth looking at. But what I've decided to do is some unconventional lessons, just in case you're missing my beautiful voice and my lovely PowerPoints. I've decided what I'm going to do is split up the skin camouflage theory side into 3 lessons like I normally would, and I'm going to deliver them like this. So I hope it's okay, I hope you can hear it okay, and I hope you can see the PowerPoint okay. This is the best I can do, I'm afraid. But by the end of this unit delivery, I hope you have learned the following. So I hope you know all you can about the range of camouflage products and application tools available for this particular sort of industry, the consultation techniques, the planning and preparation required for skin camouflage techniques, the different camouflage techniques for different body areas, and being able to provide clear and relevant aftercare advice as well. So that's what I'm hoping you're going to get out of these 3 sessions. So they're hopefully going to help you towards not only your assignment, also your exam revision, and your practical assessments as well. So there's going to be little elements of each. So I've tried to split the lessons up as easily as I can. Okay, so our first lesson is going to be about the history of skin camouflage. I'm just going to highlight some key bits for your exam. We need to talk about the benefits, the products, tools and equipment. There's some products which can be prescribed as well, so talking about those, and we're going to talk through the assessment range that we need to cover and how to work safely and hygienically as a skin camouflage practitioner. So that's lesson 1. I hope you're comfortable, I hope you've got a notepad and pen, and I hope you enjoy. I'll try and make it as fun as I can. So for the history or the origins of skin camouflage, in your assignment it's asked you to do some research, a background research on the origins of skin camouflage. So what I'd like you to do is really develop your research, really look into the whole history of it. Okay, it's really quite important that you know how it started, how things were founded, and how it's developed to what it is today, particularly if this is an area which is really interesting to you. Remedial makeup, medical aid makeup is something which is really beneficial and really rewarding. So it's something that takes time and practice to develop, just like any other makeup that you would do. This one just has an added element to it, and consultation is really important, but knowing how it founded is really important as well. But there are 4 key people and some key information that you need towards your exam. Okay, so the first person I want you to make sure you've got a note on, and I want you to make notes on this, and I want you to highlight certain bits of information. So we've got the first lady is Lydia O'Leary. She was the lady who founded and created the brand Covermark. And she developed cosmetics really, but she wanted to really develop her makeup brand towards medical aid more than sort of beauty, cosmetics sort of side of things. So a hugely inspirational woman for that. And she created the brand in 1928. Okay, then you've got someone who you'll know about, you'll know this brand, you'll know this name, and that is Max Factor. Now, it's really sad actually, I didn't know this until I started to do skin camouflage, but he has a massive player in the development of skin camouflage, and he made people's lives better. Okay, so it's something that he needs to be remembered for, and it's something I'd like you to research into a little bit more. But Max Factor teamed up with plastic surgeons. There's 2 plastic surgeons in particular who needs to be noted as well. I'm going to let you do that research yourself. But Max Factor teamed up with those in the early 1920s. And although he's really renowned for his like film, TV work, he had his magical pan sticks. He really wanted to specifically develop camouflage makeup for the war veterans who had been severely burnt in battle. So really commended there. I really love that. So that's something that you need to know. Okay, then you've got a lady called Joyce Allsworth. She founded something called the British Association of Skin Camouflage in 1985. Still going now, and it's actually a website, and something I'd like you to look into a little bit more. But the British Association of Skin Camouflage actually provides information on the history and origins of skin camouflage, the products, and just a little bit more information to sort of help you out with this particular unit. And she Joyce Allsworth, she researched deeper into camouflage products in Great Britain, and she really developed the tones, the colour corrections, and all the products. So there's a wider range really to sort of cater to a lot more different conditions, different skin tones. So she was a really, really influential person within our skin camouflage development for today. And then lastly, you've got a lady called Doreen Trust. She was born with a port wine birthmark, and she decided that she would set up a disfigurement guidance centre, and she still to this day regularly promotes skin camouflage as well. So 4 really influential people and inspirational people regarding skin camouflage techniques. And the key bits of information I'd like you to take from this. So you need to make sure you noted the name Lydia O'Leary, 1928, and cover mark. Okay, highlight those 3 aspects of that. Then you've got Max Factor, okay, and you need to sort of highlight his name, Max Factor, and war veterans and severely burnt. Okay, they're really key bits of information you need for your exam. Then for Joyce Allsworth, if you highlight her name and the British Association of Skin Camouflage in 1985, that is your 3rd key bit of information. And then Doreen Trust and Disfigurement Guidance Centre. Okay, so highlight those elements and revise and remember, okay, because they are part of your exam. Okay, and develop your research and write up your research for your assignment. Okay, next we need to talk about the differences between commercial concealers and professional camouflage makeup. One of the questions that clients often ask is, why can't I just use normal makeup? Like, what's so special about this? So we need to be able to provide that information and give the information along with the benefits of the treatment, which kind of go hand in hand with this. So I will cover quite a lot of the benefits in this section. So camouflage makeup products are highly pigmented. Okay, so they've got a good set of skin tones now, and they're really pigmented as well. So when you're doing your skin colour match, you need to make sure you're testing these products because they look a lot different in the containers than they do on the actual skin. So bear that in mind. They're also quite opaque, so they're full coverage. And they are formulated to be able to be used on all sorts of conditions and post-surgical treatments as well. Okay, what we need to say is it provides up to 75% coverage. We hope for 100% really, especially with veil cover cream, but what we need to make sure is we're not letting our clients have too high of expectations that their conditions or their disfigurements or their areas that they want concealing are going to disappear. Okay, you can't make raised areas disappear. You can't make things disappear. Okay, you can make them less noticeable, and we tend to sort of give the client a 75% coverage rate to give them an expectation. And if it's better than 75%, then you've gone above and beyond the client's expectations, which is fantastic. Then you've got waterproof, so the product's also waterproof. Okay, so that's quite important. They're very durable and long lasting, lasting up to between 8 to 16 hours. So very good if you want long lasting coverage. They're hyperallergenic. They're not particularly, you can still get an allergic reaction, but they are hyperallergenic. Okay, they have been specifically tested to be hyperallergenic. Okay, and the most important factor is that these particular products provide skin protection against the sun. Certain conditions will be aggravated or worsened through sun exposure, so making sure that we offer sun protection is really important. Okay, some limitations. So the cover cream is a water and oil product, so you can be quite limited to what products you can use in conjunction with these. So you can't use anything that's got oil-based ingredients within them. So that's something that will limit the overall finish. Okay, they are opaque as well, so that is a limitation if you're working on, for example, someone with freckled skin, so freckled skin on their body or on their face. If you're covering something like a birthmark, okay, it's going to completely conceal, okay, and it's going to stand out like a sore thumb. So sometimes what you might need to do is recreate the texture or the coloration of the rest of the skin. So maybe you need to bring in some freckle sort of effect, etc. Okay, and lastly, it's not ideal for a foundation. You need to try and tempt people not to use it as a foundation. Some of the main reasons I'm now going to explain a little bit later on. But obviously the content of it is really designed to conceal particular areas and small areas, and so it's just not ideal for foundation. Okay, so we'll talk to a little bit, so some of those like limitations and or the other sort of information about them linked to these product benefits. So I'll just highlight the benefits a little bit more. So this has been formulated, so the products have been formulated specifically for post-surgical skin. So they are quite safe to use. They will not interfere with any medications or medical treatments that you're going through. So that's absolutely fine. They are waterproof and sweatproof once applied correctly and in the correct sequence, which I'll talk about in lesson 2. They offer many premixed colours. The range of colours you can get now are a lot more wide ranged now, so a lot more readily available, so that's really quite important. It also acts as a sunscreen. It can be used in conjunction with other cosmetics as long as they're not oil based. And lastly, the most important thing that people want to know is that it's easily removed with an oil based cleanser, so very, very important. Okay, so as I say, if I just go into the limitations a little bit more, so we have said that these products will protect the skin against the sun. Okay, so it provides a sun protection. Then that's mainly because some ingredients called titanium dioxide and iron oxide. However, as good as they are and as important as they are, in certain circumstances, such as say like you're working on a bride and she's got to have her photos taken, under flash photography, some of the areas that you've worked on will appear white or paler than the rest of the skin. Even if from eye to eye you can't actually see, the skin colour match is perfect. Because of the ingredient, there's something within them that makes that particular product show up paler under flash photography. So within your consultation and within your discussion, you would need to make sure you explain that to the client. You might want to try a little bit out on the skin and take a photo with flash on just to see how it looks, but it's something that you must discuss with the client and bring up. Okay, so that is really important and key to remember. So in this photo, this lady down here, I hope you can see it. If not, the PowerPoint's on Moodle, so you can have a little look through this. But underneath this lady's eyes, she's had some skin camouflage makeup done, okay, for her hyperpigmentation. And as you can see, it's come up paler in the photo. Now some clients can be really upset about this, and they can sometimes think it looks worse than the actual condition looked in the first place. So it is something that you need to be aware of, and obviously let the photographers know as well. So if it's for a wedding or a prom or something where you're going to have your photo took, tell the photographer, okay? Let them tell the photographer that you can't have flash photography, and try and do it a different way, okay? Right, now we're moving on to products and tools that are used within skin camouflage. So we've got, sorry, it says setting powder, it should say setting spray, but basically we've got camouflage cream, we've got camouflage powder, and we have setting spray, not powder, okay? The tools that we use mainly are brushes, our fingers, our sponges, and a velour puff, okay? So with a brush, you tend to use that on small sort of delicate areas where you need to get the product in place, such as, for example, a small capillary. For fingers, I would use that over large areas with a pattern motion, obviously making sure that your hands are completely clean. This is probably one of the only sort of procedures where we can use our hands, mainly because of the density of the product, and the warmth from your fingers help to create more of an even finish and coverage. So that is quite an important tool for this particular procedure. Then you've got sponge, which you can use for larger areas. I tend to use a sponge to sort of help blend the edges of my work, and use my fingers and sponge. I tend to use my fingers, a sponge and a brush, as you see in my tutorial. And then a velour puff is used to apply the powder, pat it into the actual cream, and then leave it to set, and then brush it away. Okay, so there are our key products and tools that we would need. Okay. One thing that's not on there, which is quite important, which you'll see in my tutorial, is a spatula and a little palette. Okay, so obviously any cream-based products we should be decanting. We shouldn't be using them straight from the containers. So decant the products and mix them onto a palette and then apply onto the skin. Okay, so that's another product there. Okay, so I'll kind of put that on this one. So the equipment needed. So we need a specialised cleansing product. So to start off with, we would need sort of a cleanser for the normal skin type and a toner. Okay, and toners are quite important, which I explained once again in the tutorial where I did the practical. And you also need an oil-based product as well, which is going to remove anything that you want to remove. Okay, then you need to have disposable spatulas and sponges, or you can have the stainless steel ones where you can clean them and sterilise them as you go along. You need towels, tissues, bowls, cotton wool, a mirror, a bin, and you need your client record card as well. So talking about the products in a little bit more depth, just so you know a little bit more about them. So you have camouflage creams. Now these are your concealers, basically, your cream-based product, which comes in colour correctors. Okay, so the colour correction is used to rebalance the skin's colour and diminish some of the tones that are there, and to rebalance them. Then you've got your skin colour tones as well. Okay, so these products tend to contain no or very little oil, which makes them really durable and makes them waterproof as well. I tend to find the best way to apply is with clean fingers in a passive motion, because they tend to give the more even coverage that we'd need. Okay, then you've got camouflage powder, which is used to set the camouflage cream and provides the waterproof finish. Okay, the best way I think to apply this is to apply with velour puff. Leave to set for a few minutes and then brush off the excess. And then you've got your setting sprays. So apply the setting sprays after the powder to provide a longer lasting finish and to provide a bit more of your sun protection as well. Okay, so they're all your products, your tools and equipment. Now when it comes to the aftercare advice and talking about retailing some of your products, it's probably worth, depending on what condition the client has. There's certain conditions which come under something called the monthly index of medical specialities, and basically these will qualify you to be able to get certain products on prescription, and there's some approved brands which you can get on prescription, and this is, I've only put this in this PowerPoint because this is within your exam. So there's 5 brands that you need to know that are available on prescription. They are Lydia O'Leary's Cover Mark, you've got Keromask, Veil Cover Cream, which is the products that we use in our assessments, so really key to be able to promote that as well. Dermacolor and Dermablend. So Cover Mark, Keromask, Veil Cover Cream, Dermacolor and Dermablend. They are quite key, and you need to highlight that information because that is in your exam. Okay, so that's quite important. Okay, next I'm going to talk about the range that we would have to cover. Okay, so we have a particular range that we need to cover. I think we have 8 pieces of range, so 8 range to cover within each assessment. So we have 4 assessments that we have to cover, and within those 4 assessments we need to have concealed and camouflaged 8 conditions or range. Okay, so we've got 3 types of scarring. We've got a keloid scar, which is a thickened, overgrown scar, often from post-surgical procedures, and it's where the scar tissue overgrows the natural skin level. So they are quite thick, they're quite raised. They can sometimes have pigment still within them, be a little bit red. Sometimes they're completely discoloured, so they have no pigment in at all, so they're quite white. So that's something to sort of bear in mind. Then you've got hypertrophic scars, which are slightly raised, a little bit irregular, sort of tend to be formed from like burns or cuts of some sort that are fairly deep. Okay, so they tend to be hypertrophic scars. And then you've got atrophic scars, which are indented scars. They can be from stuff like acne scarring, so pitted sort of acne scarring, once again sort of injuries to the skin, which has caused them the skin sort of be indented. A good one is chickenpox scarring, although they're normally quite small and sort of don't really need concealing at all because there's no coloration, but that's the sort of scarring that you need to think about. Okay, so 3 different scarrings: keloid, hypertrophic and atrophic. Okay, then you've got something called hyperpigmentation, which we've all known about, and there's some things that you might be able to find out if anyone has any of these. So you've got a certain condition called melasma, or some people call it cholasma, and this is brought on through sort of extra hormones. So if someone's pregnant, you know, they might get more pigmentation around sort of their cheek, forehead, nose, sort of under the eye area, and and it's just because you've got more hormones. So sometimes if you're on a contraceptive pill, sort of increased levels of hormones will sometimes create skin conditions like melasma and chloasma, where you have darkening of pigment on certain parts of the face. You've also got things like thread veins, so they can be found on the face, particularly around the nose area or cheek area, and you have thread veins which can go on the legs as well. On the face they tend to be more of a sort of deep purple, sort of red tone. On the legs they tend to be quite deep purple. So really good and interesting for colour corrective and skin colour matching, and a lot of people want them concealed as well, so that's quite useful to find out. You've got stuff like acne rosacea, which is quite red and deep in colour, and you have obviously birthmarks, okay, they are a form of hyperpigmentation as well. Okay, then you've got hypopigmentation, which is a loss of pigment. So it's where you have no pigment in your skin in a particular area. So conditions such as vitiligo, which is complete loss of pigment in certain areas of the skin. You've got stuff like if anyone's had any skin grafts done, they can have quite an overgrowth of scar tissue, and that the pigment is completely lost in those cases there as well. And then you have something which I thought was going to be really rare, but I've had 8 students now with it, and it's a white birthmark, which I'd never heard of before, but apparently they are a thing. So that's something you can think about. And then you've got other range. So we've got our erythema, which is excessive redness of the face or body of the skin. You've got bruising. So that's one thing to look out for. See if you know anyone around your household who's got bruise, and tattoos. Okay, so they're all things that you may have to learn how to conceal in your time. One thing you can think about when you're doing your assessments is crossing some of these over. So we talked about scarring. So for example, we've got keloid scar. Sometimes the pigment can be completely lost with keloid scar, so there'll be no pigment. So you could have your keloid scar and a hypopigmentation done in one. Okay, that's one assessment. Then you've got your hypertrophic scar, which can sometimes be quite deep in colour. Some people use stretch marks for those because they can be a little bit irregular and a little bit raised, and sometimes they can be quite deep purpley, sort of reddy in colour. So you've got your hyperpigmentation and hypertrophic scar and assessment too. Okay, you might have someone with tattoo, and you might discover that, and you say, doing a tattoo on the leg, and you notice they've got a bruise. Your tattoo bruise done. Okay, and then you've got maybe someone who's had acne before, and they've got some acne scarring, and they've got quite red skin as well. So you've got your erythema and you've got your atrophic scar. That's your range done. Okay, that's your 4 assessments and all your range covered. Okay, so that's just an example anyway. So have a little think about if you know anyone with those conditions, and if there's anything we can do to sort of find those people and maybe do some assessments and do some practicing really, and practice those consultation techniques, which I'm going to talk about in lesson 2 as well. Okay, so maybe just start gathering some information and having a little practice, maybe even on yourself, to get used to using these products that you're using. So that's all the range.